जी बिल्कुल, मैं समझ गया। स्क्रिप्ट इंग्लिश में लिखनी है। आप वही स्क्रिप्ट है ना जो आपने अभी दी थी? मैं उसी इंग्लिश में रीराइट कर देता हूँ सेम इंस्ट्रक्शंस के मुताबिक। स्ट्रॉन्ग हुक, नो हेडिंग्स, 3000 to 3200 words. Host/channel name removed from body, channel name, USA Benefit Advisor, only at the end. YouTube policy compliant. अभी रीराइट करता हूँ. If you have spent your entire working life paying into Medicare and Social Security, and you feel like you are not getting back what you deserve, then this video is going to change everything for you. Because today I am going to show you exactly how to claim every single benefit that is rightfully yours. Benefits that the government and insurance companies are hoping you never find out about. They have made the system deliberately confusing, deliberately complicated, and deliberately exhausting so that you give up. But you are not going to give up, because by the end of this video, you will know exactly what to do, who to call, and how to fight back for every dollar you are owed. For decades, you have been paying FICA taxes out of every single paycheck. FICA includes a Social Security tax of 6.2% and a Medicare tax of 1.45%. Your employer also pays their matching share of 1.45%. If you earned higher income, you paid an additional Medicare surtax on top of that. This has been happening for 30, 40, even 50 years of your working life. Every 2 weeks, money came out of your check and went straight to the government for Medicare. You would think that after paying into the system for that many decades, Medicare would be completely free when you finally become eligible. But that is not how it works. When you start Medicare, you still have to pay a Part B premium every single month. Right now, that monthly premium is significant and it comes right out of your Social Security check or you pay it directly. And if you happen to earn a higher income a couple of years ago, you are paying an additional IRMAA surcharge that can be an extra $100, $200, $300, or even $400 every single month on top of your regular premium. Then there is Part D for prescription drug coverage, which has its own premium as well. And on top of all of that, Medicare is also funded by general tax revenue, which means your regular income taxes are also going toward Medicare. So you are essentially paying 3 times. You paid payroll taxes for decades, you pay a monthly premium now, and your regular taxes fund the program too. When you are paying that much into a system, you need to make absolutely sure you are getting every single thing you are entitled to receive. Recently, something happened that you need to know about. The government initially announced that they were not going to increase payments to Medicare insurance companies. But then, the lobbyists went to work. They went to Washington, D.C., they had their meetings, and suddenly billions of dollars in additional funding was approved for these insurance companies. We are talking about $13 billion. That is not their money. That is your money. That is taxpayer money that came from your paychecks and your taxes. And do you think these companies are going to turn around and hand that $13 billion directly back to you in the form of better benefits? Absolutely not. Not unless you fight for it. Not unless you know what you are entitled to, and you demand it. That is exactly what I am going to help you do today. Let us start with prescription drugs because this is where a lot of people are losing money without even realizing it. This year, the Part D out-of-pocket cap is $2,100. That means the maximum you will pay for prescription drugs in a year is $2,100. That is good news. But here is what most people do not know. If your Medicare Advantage plan has a formulary and your specific medication is not on it, or they want you to take a cheaper alternative that does not work for you, you have the right to request a formulary exception. You can tell your plan that you need a specific medication and ask them to cover it even though it is not on their standard list. Many people do not know this option exists and they just accept whatever the plan gives them. Do not do that. You also have the option of 90-day mail order prescriptions, which can often save you money compared to filling your prescriptions monthly at a pharmacy. There is a brand new feature this year that is now automatic, and it is called smoothing. Here is the problem it solves. If you have very expensive medications, you might hit that $2,100 cap in January or February alone. That means you have to come up with a huge amount of money right at the beginning of the year. Smoothing takes that $2,100 maximum and spreads it evenly across all 12 months of the year. So instead of paying everything up front in the first couple of months, you pay a smaller amount each month throughout the year. This program existed last year, but you had to opt into it manually. This year it is automatic. You do not have to do anything to enroll. It just happens. This is a big deal for people who have expensive medications and struggle with those large upfront costs at the beginning of the year. Another huge program that many people miss is called Extra Help. This is available through the Social Security Administration, and it helps people with limited income pay for their prescription drug costs. The application process is one of the easiest ones that Social Security offers. If you or someone you know is struggling with prescription drug costs, call Social Security and tell them you want to apply for Extra Help. They will know exactly what you are talking about, and the application is straightforward. You would be amazed at how many people qualify for this program, but never apply because they simply did not know it existed. Now let us talk about benefits you are already paying for, but might be losing because you are not using them. This is critical to understand. Medicare Advantage plans only last for 1 year. I cannot stress this enough. If you hear someone say they have had the same Medicare Advantage plan for 4 years, that is technically not accurate. They may have had the same company and the same plan name for 4 years, but the actual plan itself resets every single year. On December 31st at midnight, your current plan disappears completely. On January 1st, a brand new plan starts. Same company, same name, but all the details including benefits, networks, formularies, and costs can change completely. This is why reviewing your plan every single year is absolutely essential. You do not necessarily have to switch plans, but you must review what changed because the plan you loved last year might be terrible for you this year. Because these plans reset every year, any benefits you have not used by December 31st are gone forever. They do not roll over. If you have a flex card or a grocery card or any kind of allowance card from your plan, use it before the year ends. Some of these cards expire monthly, some quarterly, and some at the end of the year. Check your specific card to find out. I cannot tell you how many people have these cards sitting in a drawer because they got something in the mail and thought it was junk or a promotional offer. They had no idea there was $100 a month on that card for groceries or utilities or over-the-counter items. By the end of the year, they have lost $1,200 or more that was rightfully theirs. Starting January 2026, the rules around these cards have changed. They used to be more generous and easier to qualify for. Now there are more hoops to jump through, and the values have generally been reduced. But they still exist. Just be careful about the advertisements you see because some Medicare insurance agents promote these cards in very misleading ways. If your plan offers one, find out the details and use every dollar on it. Check your vision benefits. Eye exams and glasses may be covered under your plan. Look into your fitness benefits because many plans offer gym memberships or fitness programs at no additional cost. Post-discharge meals are another benefit some plans offer after you leave the hospital. These are all things you are paying for, whether you use them or not. Dental is a big one, and here is a strategy that can save you thousands of dollars. Let us say you need $4,000 worth of dental work, but your plan only covers $2,000 per year. Here is what you do. Go to your dentist and plan the work in 2 phases. Do $2,000 worth of work this year, using this year's benefit maximum. Then on January 1st, when your plan resets and your dental benefits renew, do the other $2,000 worth of work. You have now gotten $4,000 of dental work covered across 2 plan years. Talk to your dentist about this strategy because they understand how insurance works and they will help you plan the timing. Transportation to medical appointments is another benefit that many plans include but people forget about. If you need a ride to the doctor and your plan offers transportation benefits, use them. In-home support services are also available through some plans. Check what your specific plan offers because you might be surprised at what is included. Now here is the most important thing I want you to take away from this entire video. You have to fight back. The system is designed to be difficult. Whether it is Social Security, Medicare, Medicaid, SNAP benefits, or Medicare Advantage plans, the process is intentionally complicated because they know that if they make it hard enough, people will give up. They reluctantly give you the benefits you already paid for, and then they make it incredibly difficult for you to keep those benefits. A lot of people do give up. But you are not going to be one of those people. You are going to keep fighting until you get what is yours. Let me tell you about a trick that hospitals play that costs people thousands of dollars. It is the difference between inpatient admission and observation status. You go to the hospital, you stay for 2 nights, you assume you were admitted. But then the bills come, and they are enormous, because it turns out you were never actually admitted. You were just under observation. In your mind, staying overnight in a hospital means you are admitted. But that is not how the system works. They can keep you in a hospital bed for 48 hours or more and classify you as observation only. This classification dramatically changes what Medicare covers and what you have to pay out of pocket. So every single time you go to a hospital, ask this specific question. Am I being admitted or am I under observation? Get a clear answer, and if you are under observation, understand what that means for your costs. When a claim gets denied, do not accept it as final. There are multiple levels of appeals available to you. First-level appeal, second-level appeal, hearing before a judge. You can keep fighting. The statistics show that many claims that are initially denied get approved on appeal. The insurance companies know this. They deny claims hoping that most people will just accept the denial and move on. Do not be one of those people. Appeal every single denial that you believe is wrong. Verifying that your doctor is in network has become more important than ever before. States are receiving hundreds of billions of dollars less in Medicaid funding this year. That means states are going to be cutting doctor networks and hospital coverage because they simply do not have the money anymore. Doctors who used to accept Medicaid will stop accepting it. The ones who still do might not be the best options. This situation is going to get significantly worse going forward, and you need to stay on top of your network status constantly. There was recently a situation with ghost networks on the official Medicare website. People went to medicare.gov to check if their doctor was in network. The website confirmed that yes, their doctor was covered under a specific plan. So they enrolled in that plan based on that official information. Then they found out their doctor was actually not in that network at all. Medicare had to offer a special enrollment period to let those people switch plans because the government's own website gave them wrong information. This shows that you cannot blindly trust even official sources. Always confirm directly with your doctor's office that they accept your specific plan. There are several situations that allow you to change your plan outside of the regular enrollment period. If you move to a new area, if your Medicare eligibility changes, if you gain or lose extra help, if your plan loses its Medicare contract, or if a 5-star rated plan becomes available in your area, you may qualify for a special enrollment period. For most people, the annual enrollment period in October is when they can make changes. But if you have a special circumstance, you might be able to change earlier. Reach out to a knowledgeable Medicare advisor who can help you determine if you qualify for a special enrollment period. Prior authorizations are one of the biggest frustrations with Medicare Advantage plans. When you are on original Medicare with a supplement, your doctor says you need a treatment and you get that treatment. It is simple. But with a Medicare Advantage plan, your doctor has to ask permission from the insurance company before providing certain treatments or procedures. The insurance company then decides whether they want to spend that money on your care, and quite often they say no. Then you have to fight through the appeals process to get the care your doctor says you need. This is a system where a corporation is essentially overruling your doctor's medical judgment to protect their profits. It is your money that they receive from the government, and they are deciding whether to spend it on your health care. Remember that emergency care is always covered regardless of what plan you are on and regardless of whether you are in or out of network. In an emergency, never hesitate to get care because you are worried about coverage. Emergency care is always covered by law. Let me explain how Medicare Advantage plans actually work financially, because this is something that confuses a lot of people. When someone says their Medicare Advantage plan costs $0 per month, they think they are getting free health care. They think the company giving them gym memberships and grocery cards and hearing aids is doing it out of the goodness of their heart. That is not how it works. When you enroll in a Medicare Advantage plan, that company goes to the government and says, "Give us money for this person every single month," and the government pays them. If you are a relatively healthy person in an inexpensive part of the country, The plan is receiving about $500 to $700 per month for you. If you have multiple health conditions and live in an expensive area, they are getting $1,500 to $2,000 or even $2,500 per month. You are not paying zero. You are paying $500, $700, $1,500 a month. That money comes from taxpayer funds, which means it comes from you. The formula for calculating these payments is incredibly complicated, but make no mistake, these companies are getting paid handsomely for every person they enroll. This creates a perverse incentive in the system. The sicker you appear on paper, the more money the company receives from the government. So some plans benefit financially from documenting you as being sicker than you might actually be. At the same time, they want to spend as little as possible on your actual care to maximize their profit. They get more money for sicker patients but want to provide fewer services. That is a fundamental conflict of interest that is built into the entire Medicare Advantage system. So remember this: you paid for the steak. Do not accept the hot dog. Do not accept a system that takes your money for decades and then makes you beg to get basic benefits. Know what you are entitled to. Use every benefit available to you before the year ends. Plan strategically with your healthcare providers and fight every denial. The system is hard, but it is not impossible to navigate when you know what you are doing. One more thing that comes up frequently is the Social Security earnings limit. If you are collecting Social Security benefits and you have not yet reached your full retirement age, there is a limit on how much you can earn from work before your benefits get reduced. This year, that limit is $24,480. Last year, it was $23,400, so it went up slightly. As long as you stay under $24,480 in earnings, your Social Security benefits will not be reduced at all. But here is the important part. Once you reach your full retirement age, there is no earnings limit whatsoever. You can earn $1 million a month, and it will not affect your Social Security benefits one bit. A lot of people get confused because this number changes every year, so make sure you know the current year's limit. Take all of this information, save it, print it out, put it on your refrigerator, share it with your friends, bring it to your senior center. The more people who know this information, the better off everyone will be. This system rewards people who are informed and who are willing to fight. Do not leave money on the table. Do not let benefits expire unused. Do not accept denials without appealing. You paid into this system your entire working life, and you deserve every single dollar back. Make sure you like this video, share it with anyone who needs this information, and subscribe so you never miss important updates that can save you money and protect your benefits. USA Benefit Advisor.